In late January, a traveller returned to Brighton in East Sussex, causing what was then believed to be the first person-to-person spread of COVID in the UK. As cases rose, the government announced its strategy.
Mr. Speaker, we have a clear four-part plan to respond to the outbreak of this disease: contain, delay, research and mitigate.
As soon as COVID started to spread, scientists knew testing would be paramount, because a test doesn't just tell you if someone's infected. It's the only way of seeing how coronavirus is moving among us. Every decision we've made, from where we can travel to when to lock down, was dependent on testing. So was our failure to get testing right the reason the UK suffered one of the worst outbreaks in Europe so far? No one from the front lines of Public Health England has been allowed to speak out during the crisis. We interviewed this registrar contracted to PHE on condition of anonymity to protect his civil service colleagues.
We were relatively constrained with the number of tests we were offering. We were offering to just the symptomatic people, so we couldn't screen the contacts out. There were so many issues in terms of communication with people calling up us to try and organise tests, people calling up the hospital to organise tests, people calling up their GP to organise tests, and then the GP would call us, and back and forth it went.
Studies have since shown that between early February and mid-March, not handfuls, but thousands of COVID cases were arriving in the UK from abroad. With no testing, no one saw this wave coming. But as it arrived, PHE insiders knew they wouldn't have the capacity to cope.
Exponential growth is a terrifying thing. Early March, we were starting to see dozens of cases per day, and then the middle of March, we're seeing hundreds. We knew at that point we weren't going to be even able to reach all the cases, let alone all the contacts of the cases.
Faced with that, the government abandoned its containment plan.
It is no longer needed for us to identify every case.
The limited testing capacity was diverted to hospitals. But scientists had no idea how the virus was spreading in the wider community because testing there wasn't being done. It was a key failure, according to Neil Ferguson, then the government's leading advisor on the pandemic.
We were planning and analysing stuff in the dark. I and colleagues on SAGE were pushing hard that we needed to stand up reliable, what was called sentinel surveillance in the community, both in the community itself and in hospitals, to get a handle on what was happening within the country.
And that wasn't happening?
It was stood up, but it just took longer than would be desirable. It was only really from 11th, 12th, 13th of March, with national level hospital surveillance, we really understood the scale of what the country was facing.
Cases grew exponentially. The WHO had one word for it.
We have a simple message for all countries: test, test, test.
Now the government had run into a major problem. There simply weren't the Public Health England labs and staff around the country to meet testing demand.
And that cost the UK significantly.
Do you think lives were lost because of our lack of testing?
I agree with Neil Ferguson. I think that you would have reduced fatalities substantially had we got testing in place earlier and had we reduced the number of introductions into the country in March.
A lot of the funding had been cut from our pandemic planning years before this, not in the short term, but in the long term. There's no way that the local teams could deal with a widespread outbreak on the scale that we saw.
2 months after the outbreak began, testing was ramped up.
I am now setting the goal of 100,000 tests per day by the end of this month.
Those numbers would come from centralised lighthouse labs. Alan McNally helped run the first.
The day I arrived, we did 50 tests with 6 people. 3 weeks later, we had 240 people working in the facility, 24 hours a day, 7 days a week, 30,000 tests a day.
The labs met Matt Hancock's testing targets, but the centralised system couldn't keep across COVID hotspots.
Local is better. Local is what works. You want to contain an epidemic, contain it locally. It's like a forest fire. There's not one huge fire, there's lots of little ones that join up. And a local intervention strategy stops the little fires from joining up.
By June, the early failure to test was apparent.
And many of the problems that we had came because we were unable to actually work out exactly where we were.
Would testing have been sped up sooner if they truly trusted the science? Professor Ferguson says early data matched the worst case scenarios he'd drawn up for ministers. He thought the numbers would speak for themselves. Now he wishes he'd spoken for them.
I always took the very strict view that it wasn't my job to tell government what to do. But I did have concern that we were looking at these numbers week after week and almost the scale of what was seen in those numbers was not quite sinking in. And maybe I could have been more forceful at saying, you know, are you really sure you want to go through this? I mean, I did say that at various points, but I could have done so more forcibly earlier.
There's no question the government gets the gravity of the situation now, but its testing system is carrying out hundreds of thousands of tests a week and already struggling at the first sign of cases rising again.
The brilliance of any testing regime is that you target the tests, you use the tests where they're most needed, and you don't just open the doors to anyone. And that's coming home to bite us now.
We learned to our cost that you can't really have enough tests for coronavirus, but also it's not just a numbers game. Tests are almost pointless unless you know who, where, and ideally why someone has tested positive, and also get that information before they go on to infect others. Unless that whole system is in place, we risk remaining in the dark, 2 steps behind an invisible killer.
And Tom is here, of course, to talk about all this fascinating report. 2 questions, I guess. 1, what does the government have to say about what you were talking about there? And 2, I think a lot of people watching that will be amazed, frankly, that you say all that. We had the summer relatively quiet, and yet here we are again buckling at the first sign of strain.
Yeah, well, of course, we did invite the government, someone from the Department of Health or Public Health England, to take part in the film and be interviewed, and no one was available to do that. They did, however, tell us this evening they've always listened to the advice of their scientists. They say they acted as swiftly as they could to ramp up testing as fast as they could. And also that they are, of course, now prioritising testing to try and manage the demand they've got. Where it leaves us now, you have to ask the question, a rise in cases was entirely predicted and predictable, especially around the time schools go back. We have committed huge amounts of money to testing. £100 billion was the amount given by the Chancellor of the Test and Trace system. There's more bigger numbers have been thrown around, if that's even possible, since. The will, the money is there. As MPs challenge the government to stay on exactly this issue, there's enough evidence to suggest about 500,000 people a day can come with sniffles and colds and coughs and colds at this time of year. You surely should have seen you'd need that kind of capacity, but we're being told now we have to wait till October until we get that high level. The government says to us, massively ramping up capacity now. I think the real question is, will it be ready in time? And we're missing out really important details. Let me just add this. We learned today that as you heard in Romilly's report, we're missing out on surveillance for the virus now because the test and trace system isn't working, so we're not testing everyone. But even the Office of National Statistics survey, on which we rely so much for forecasting the outbreak, that's reliant on this system too. We don't yet know if it's been affected, but it could really affect our ability to do surveillance on this outbreak.